I was previously in a car accident about 4 years ago. I was driving to work and a car stopped in the middle of the highway. I clipped that car, my car spun around, and the car behind me actually hit me from the front. It was a high-speed accident. I sustained a lot of injuries. I broke my sternum, I sustained injuries to my knee and my bladder, and I had injuries to my discs in my neck and my back, and of course I was really bruised up. And then about 12 months ago I had a second car accident and I further injured my back. About a month or so later, after the second accident, I was at home. We'd recently got Kanye, my new puppy, and I leant forward slightly to pat him and I felt like I'd been shot in the back. The injuries from my back, from the discs bulging, had obviously bulged a lot over time, and I injured my back even further from the second car accident. So the discs that were bulging were slowly making their way into my spine.
Krystle's been a patient of mine for a few years, and she had a car accident some years ago which resulted in a serious pain diagnosis with her right leg called complex regional pain syndrome. We've worked pretty hard on that leg and we were able to restore a lot of function for her and get her able to do things in between hospital visits that she hadn't been able to do for quite a while beforehand. So when she came in to see me on the 1st of March this year with a new back problem that was threatening how well she could use that leg, as well as a serious threat to her bladder and bowel function, I knew this was a potentially disastrous situation that needed rapid action. So I actually rang our radiology colleagues downstairs. I told them about the situation and requested an urgent MRI. She was having the scan within about an hour or so of that first phone call, and as a result of that she was in surgery, getting her decompression surgery within an hour or two after that. So it was a very quick emergency response that really has actually saved her bladder and bowel function and enabled her leg to go back to being able to be used the way that we could before. And the outcome of the whole episode, which threatened complete disaster, was that she actually is just as good now as she was before it happened, and a large part of that was due to the availability of high quality imaging.
I think everyone should be able to have access to MRI. It shouldn't be a matter of money and if you can afford it, because if I hadn't had that TAC funding, my MRI would have cost $900 out of pocket, which no one really has $900 just laying around for an emergency that could happen at any time to anybody.
This whole episode, which was managed really about as well as it could possibly have been done, world-class standard of care, just wouldn't have been possible without that insurance having been there. So what I learned from that is that that's a level of care that I'd love to be able to provide to everyone who walks through the door here, and an MRI licence for our scanner is going to enable us to do that.